So there are two different main forms of birth control. One only contains a single hormone, it's progesterone. That's the progesterone-only pill. And then, of course, there are the combined hormonal contraceptive pills, which contain both estrogen and progesterone. The main difference between the two is that with the progesterone pill, because it only has one hormone in it, it's really important that that pill gets taken at roughly the same time every day, maybe within an hour or two of it. So I always tell my patients, you don't want to take it at 9 o'clock in the morning one day and 3 o'clock in the afternoon the next day and kind of bop all over the day with taking the pill. With the birth control pill that has both the hormones in it, both estrogen and progesterone, you get a little bit more flexibility. Again, you don't want to run across the clock and take it at once in the morning, once at night. You kind of want to stick within a little bit of a range of 2 or 3 hours. But having two hormones just gives you a little bit more of a cushion than having that single hormone birth control, and you really have to be great about taking it about the same time every day. If a woman starts a birth control pill, whether it is the progesterone-only pill or the combined hormonal pill, which contains both estrogen and progesterone, within the first 5 days of their cycle, they don't need to use any backup method. Now, of course, that comes with the caveat that if it's a new partner or someone that you're unsure of and you want to protect yourself from sexually transmitted infections, always use condoms. In terms of effectiveness, when you begin a pill after the first 5 days of your cycle, if it's progesterone only, you do need to use backup for a couple of days, 2 or 3 days. If you're taking the combined hormonal pill and you've started it beyond 5 days of your cycle, you will need to use backup with a condom for at least 7 days. Men can play a very active role in pregnancy prevention and the prevention of infections with their partners. For one, they can have condoms on hand, so if necessary, for a method of backup or to create a barrier so that if it's a new partner and you don't want to be exposed to any possible infections, you can use a condom. In terms of women who are on the birth control pill, they can play an active role by downloading an app or setting their phone to go off at a certain time every day. That would serve as a reminder for when their partner needs to take their birth control pill. And lastly, they can also purchase emergency contraception either over the counter or online and have a couple of those boxes on hand. So if a condom breaks or for whatever reason they feel like they may not have been fully protected from preventing a pregnancy, that they have that on hand that they can provide their partner to take to help reduce the likelihood of an unintended pregnancy.